Students, welcome to the next video session in your bone lesions. Okay, so in the previous segment we have seen the developmental anomaly, right? In this video we are going to see a aspect called fibrous lesions. Okay, fibrous, please listen carefully. Fibrous lesions are a confusing stuff to many students, right? They still don't have a clear idea, they don't have a clarity in the fibrous lesion. What exactly is fibrous lesion? So see, let's keep it very simple. It is very simple concept, and you can ask any you can answer any question they ask from fibrous lesions once you see this video very carefully. Okay, so fibrous lesions, we learn by comparing it with the what someone. Okay, let's see that I say I compare fibrous lesion with girls. Okay, so there is nothing offensive. Okay, nothing offensive. These are all techniques to what learn. Okay, rather than by hearting, to understand. Okay, so I take the blame myself that okay, fibrous lesions is something related to a girl, or my wife or something. Okay, so something like that. See, you may see that there is a bone here. Okay, we have a normal bone here. Our bone was perfect, right? Our bone was perfect. We had a good bone. Now our body will think that why there is a bone here, let's convert it into some fibrous tissue. Okay, so I have converted it into some fibrous tissue. uh, so once the fibrous tissue is formed, and now the body is thinking, why there is a fibrous tissue, let's convert it into a bone. Okay, so this is what happened in a fibrous lesions. Like, it's like the mood swings of girls, right? They don't know what they are doing. It was a very peaceful situation, and they did something, and after they do something, they will think that why I did this. Okay, it was perfect in the previous time. So it's like that. There was a bone. Our bone is perfectly fine, and this bone tissue, the heart bone tissue, is converted to fibrous tissue, and this fibrous tissue is again ossified to bone. Okay, and that ossification will be defective. Okay, so the normal one will become a defective one with what there's no purpose in doing this, right? So this is happening in fibrous lesion. Okay, so the bone is converted to, or bone is undergoing fibrous changes, and the hard bone is converted to fibrous tissue. Okay, and then again it becomes starts ossification, and it will become defective bone. So if you take the radiograph, of fibrous lesions, all the radiograph will be in the initial stages. Initial stages where there is only fibrous tissue is will be radiolucent, and when the ossification starts, it will be mixed radiolucent, radio opaque. Okay, that is an intermediate stage. Okay, intermediate stage, and by the end of this fibrous lesion, by the late stages, it will completely become radio opaque again, because of the bone formation. So this is the feature of a fibrous lesions. Okay, they themselves don't know what they are doing. Okay, this is fibrous lesion. Now, there are three members in this fibrous lesion. Just three members. First one, second one, third one. Let's see the three members. And one member is a developmental anomaly. Second member is a reactive lesion. Third member is a tumor. So we have representation from all the community in this fibrous lesion. I say that girls, wherever they are the same. Okay, so from the developmental anomaly, there is a fibrous lesion which coming from the developmental anomaly, that is fibrous dysplasia. Okay, fibrous dysplasia. Fibrous dysplasia is a fibrous lesion that is a developmental anomaly. Okay, developmental anomaly. And then comes the next one, that is a reactive lesion, that is cemento-osseous dysplasia. Cemento-osseous dysplasia. Okay, so fibrous dysplasia. Next one is cemento-osseous dysplasia, and that is a reactive lesion. That is considered a reactive lesion. Now the last one is ossifying fibro. Okay, ossifying fibroma, and this is a benign tumor. A benign tumor. So fibro-osseous lesion is actually a representation from all the three. Now I think you got an idea about what includes in fibro-osseous lesions and what happens in fibro-osseous lesion. This much. This is the concept. Okay, there is no big rocket science in this. Okay, so this is the concept. Now let's see the first one, fibrous dysplasia. Okay, I'm gonna take the first one, fibrous dysplasia. So if I take the fibrous dysplasia, what to learn in fibrous dysplasia? Fibrous dysplasia, first point, you know, it is developmental anomaly. Okay, will it transfer from one generation to another? No, it is non-hereditary. Non-hereditary. Okay, and a developmental non-hereditary condition, and where you can see the normal bone is converted to a fibrous tissue and then it is again converted to a bone. Okay, so that is a defective bone. So you can see the bone, defective bone formation due to this conversion or fibro-osseous conversion. Okay, and there is a gene, as it is developmental, we have a gene which is mutated here. What is the gene mutation? The very famous MCQ. Okay, very famous MCQ, most important MCQ, GNAS1. GNAS1 gene is the mutation here. Guanine nucleotide binding protein alpha stimulatory polypeptide, alpha stimulatory activity polypeptide 1. Okay, so there's a very big name and it doesn't matter, you just remember GNAS1. Okay, and what is the function of the gene? If you know the function of the gene, you know all the clinical features. What this gene does? This gene, GNAS1, controls your second messenger. It controls a second messenger, that is cyclic GMP. Okay, GNAS1 gene controls a second messenger. This messenger is the one who is giving signals to cells what they should do, right? So according to the signals, the cells will act. So cyclic GMP is a second messenger. And what does the cyclic GMP do? What is the function of the cyclic GMP? He controls 3 cells here. Okay, he is the one controlling 3 cells here. Cyclic GMP. He controls osteoblast he will control. Okay, and second one, he controls melanocyte. So osteoblast is the one who is making up your bone and all. Melanocytes give you pigments, and third one, they control the endocrine cells. Okay, so these are the 3 cells which is controlled by cyclic GMP. Now the clinical manifestation occurs based on the time where this mutation occurs. If this mutation occurs when the child is inside mother's womb, means child is not born, then what happens is that if this mutation occurs in the prenatal period, means if the child is inside the mother's womb and the mutation has happened, all these 3 cells will be affected. All the 3 cells will be affected. Okay, all the 3 cells will be affected. But if the mutation is occurring after birth, okay, if the mutation is occurring after birth, only your osteoblast is affected. Okay, osteoblast is affected. See what the concept? Okay, so when this is due to fibrous dysplasia is due to mutation of GNAS1 gene. GNAS1 controls your cyclic GMP. Cyclic GMP controls 3 cells: osteoblast, melanocytes, and endocrine cells. So the clinical features, the clinical manifestation in the patient depends upon the time period where this mutation has happened. If it is in the prenatal period, all the 3 cells will be affected, and if it is after birth, only osteoblast will be affected. So when all the 3 cells are affected, you can see that what all features you can see that you can see bone lesions. Osteoblast will cause bone lesions. There is swelling of the bone. Okay, and it will affect multiple bone. Many bones it will be affected. Multiple bones will be affected. It will affect almost all the bone because it's a time of development and this mutation has happened. It will affect almost all the bones. Okay, then it will affect the melanocytes. So what do you see when there is melanocyte being affected? You see pigmentation in the body, and that pigmentation is called cafe olate pigmentation. Cafe olate means coffee in the milk pigmentation, and it will affect your endocrine cells. When it affects endocrine cells, the child will be having precocious puberty. Okay, precocious puberty means early puberty. Okay, so these are the things. When all the 3 are seen, When the bone lesions are seen, that is multiple bone lesion, we call it polyostotic. Polyostotic fibrodysplasia. Polyostotic means multiple bone is affected. If it is only one bone, it is called a monoostotic. Okay, so if there is polyostotic fibrodysplasia, if there is pigmentation like caffeolate pigmentation, and there is precocious puberty, means all the three, Albright syndrome, Albright syndrome. Okay, so if all the three are seen, it is Albright syndrome, polyostotic fibrodysplasia, and this pigmentation, caffeolate pigmentation, and precocious puberty is Albright syndrome. If only the first two is seen, we call it, what we call, if the first two is seen, it is called Jaffe syndrome, Jaffe-Lichtenstein syndrome. Okay, and if this person has fibrodysplasia, means he got his bone gone and his muscle also gone. Okay, they have some problem with muscle. Okay, the person is having fibrodysplasia, already his bone is defective. Now he has some problem with the muscle, that is muscle myxoma. He has muscle myxoma. MUS, muscle myxoma. Myxoma is a tumor occurring in the muscle. So then it's like maza. Okay, maza in Hindi, maza means fun, right? So this guy is already, his bone is gone and his muscle is also having defective now. So very good. Okay, maza. Yeah. Okay, Mazabot syndrome. So this is how we have to relate and learn, right? So there is no need to by heart. There is nothing to by heart here. Just listen, just to understand what really happens here, what is really happening to the patient. Okay, the mutation, when it happened. So what are the three cells controlling? Okay, and if it is before puberty, before birth, all the three is affected. When all the three is affected, osteoblasts affected, you have polyostotic fibrodysplasia, you have pigmentation, caffeolate pigmentation, you have precocious puberty, all the three affected, Albright, all the three Albright. And then if two is affected, Jaffe-Lichtenstein, and if the muscle myxomas are also there, we call it Mazabot syndrome. I hope this is clear to you, the fibrodysplasia. Now let's see some difference between monoostotic and polyostotic. Monoostotic and polyostotic fibrodysplasia. What is the difference between monoostotic and polyostotic? See, monoostotic fibrodysplasias are the one usually affecting your face, our craniofacial region. So monoostotic usually affects your single bone. It is affecting your single bone or your craniofacial bones. Okay, craniofacial bones are most commonly affected. And other than this, craniofacial ribs are also affected sometimes. Then comes the fever. While polyostotic will affect more bones. More bones are affected, mainly your femur. Okay, long bones are affected most commonly. Okay, and monoostotic fibrodysplasia, if you take the craniofacial bone, maxilla is most commonly affected. Maxilla is affected than mandible. See why I am saying this, because these are all clinical based question. They will give you a question like a patient coming to the clinic or patient presenting with a swelling in the maxilla. And this is usually unilateral, and it is mostly seen in the posterior maxilla. The posterior region is very favorite than the anterior region. Okay, so that is one thing, posterior region. And there is a particular feature of this swelling. The swelling will appear like this. Okay, it's called fusiform swelling. Fusiform swelling means the two ends of the swelling will be tapered, and in the center it will be bulging more. Okay, so in the center you have a wide thickness. So that is called a fusiform swelling. Okay, fusiform swelling. Okay, that is one thing, fusiform type of swelling, and it is usually unilateral. That is very, very important. Unilateral means it will not affect both sides, it will be on the one side. So there is unilateral fusiform swelling of the posterior maxilla. So this is how they give the question. A child presents with, usually this is seen in young individuals, right? By after development it starts. Okay, so a child with a fusiform unilateral swelling of the maxilla. Okay, and on radiograph, what is on the radiograph? You see most of the time you see a mixed radiolucent radio opaque appearance, right? If you see a mixed radiolucent radio opaque appearance, because it is a mixed lesion, is a fibrous lesion, you see a mixed radiolucent radio opaque appearance. Okay, and that appearance is called pudy orange, pudy orange, or orange peel appearance, or we say ground glass appearance. Okay, you have seen frosted glass, right? Ground glass appearance, pudy orange appearance. What else you can see in the radiograph? You can see that when you take a radiograph in fibrous dysplasia, you can see that the periodontal ligament space is narrow. There's a narrowing of PDL space. Narrowing of PDL space. PDL space widening is seen in osteosarcoma. PDL space narrowing is seen in fibrous dysplasia. This is how you should learn the tips. Okay, so PDL space, when it comes to PDL space, what you know about PDL space? PDL space widening is seen in your osteosarcomas. PDL space narrowing is seen in your fibrous dysplasia. Okay, so all these are features you see in your dysplasia, in monoosteotic fibrous dysplasia. Polyosteotic fibrous dysplasia, nothing much. It is mostly related to your long bones, and this is mostly related to your syndromes. Okay, all the syndromes like your Mazabot syndrome, Jaffe syndrome, Albright syndromes, or all the syndromes are seen. Cafe-olate pigmentations are seen. Here also you can see cafe-olate pigmentation. Cafe-olate pigmentations are seen on the body, and there's a peculiarity for this cafe-olate pigmentation. I will show you the image and then discuss that. Okay, can you see this image here? Okay, see this pigmentation. This is called a cafe-olate pigmentation. Cafe-olate pigmentation means coffee in the milk pigmentation, and you can see that the coast, the borders. Okay, the borders are irregular borders. Now there is a question regarding this cafe-olate pigmentation. There are two conditions where you can see cafe-olate pigmentation. One is neurofibroma. Also you can see cafe-olate pigmentation, and your fibrous dysplasia you can see cafe-olate pigmentation. In both places you can see cafe-olate pigmentation, but in neurofibroma the pigmentation will have smooth border. In fibrous dysplasia you have irregular border. So they have compared it with the seashore of what you see in the United States. There is California and Maine. Okay, Maine, Maine and California. The coast of the California is smooth. Okay, so coast of California is very smooth border. Okay, so they say it is like a coast of California border, and irregular border is just like a coast of Maine. So these are two places in United States, and the seashore, the type of seashore they have is smooth in California and irregular in Maine. Now, how to remember this? How to remember without by hearting? Neurofibroma is a soft tissue tumor. Okay, your neurofibroma is a soft tissue tumor. Fibrodysplasia is a hard tissue tumor. So hard is irregular, soft is smooth. Right, the soft is smooth, and the C, when you write the C of California, it is very smooth. But when you write M of Maine, it is irregular. When you write M, it is irregular. Okay, so when you write M, Maine is irregular, it is in the fibrous dysplasia, and C is smooth in the coast of California. Okay, so this is how you remember. Now, what about the histology? This is a histological picture. In the histology, you can see all these are connective tissue areas, doesn't matter. Okay, you can see this bony trabeculae here. Bony trabeculae means the bone is being formed in the connective tissue, that fibrous connective tissue. That's why it is called a fibro-osseous lesion. Right, the fibrous tissue is there, the bony trabeculae is there, and this bony trabeculae is looking like a Jackie Chan movie. You may have seen Jackie Chan movies. Okay, I hope you have seen Jackie Chan movies. Okay, or any Chinese movies you may have seen. Okay, so the Chinese alphabets, you have seen the Chinese alphabets. It is very irregular, and we don't know. God knows what they are writing. Okay, and they all look similar. Okay, the guys look similar and the writing looks very different. Right, so you can see that this is like looking like a Chinese letters. Okay, so this is called a Chinese letter pattern. Chinese letter pattern of the trabeculae is one interesting thing. Or we say alphabet soup pattern. Alphabet soup means that you put this alphabets in a soup, A, B, C, D, E in a soup, and it is mixed. Okay. Another thing you can see that the connective tissue and this trabeculae has one white space in them. Okay, some space is formed between the trabeculae and the connective tissue, that is called a peritrabecular cleft. Okay, trabecular cleft. So this is one interesting histological feature. There is no much thing. Now, how you treat this fibrodysplasia? Treatment. What? How can you treat? Usually, there is no treatment required till skeletal maturity. Till skeletal maturity, you should not give any treatment. It will let the bone mature, and then you can give a surgical contouring if it is affecting the aesthetics. Okay, surgical contouring can be given if it is affecting the aesthetics of the person. If it is a girl child and it is affecting her aesthetics, you can give a surgical contouring. Okay, but till maturity, you should not touch it. Let it be there, and you should not give radiation. Never. Radiation is contraindicated. Radiation is contraindicated because if you give radiation into fibrodysplasia, it will cause osteosarcoma. Osteosarcoma. Okay, and so there are some things you can see in the serum of these patients. If you take their blood and you go for lab diagnosis, and this is a very, very favorite question for your NEET. In the lab diagnosis, if you take in mono-osteotic fibrodysplasia, you can see that what about the serum calcium? What about the calcium levels in the blood? The serum calcium and the serum phosphorus. If I take the serum phosphorus, serum calcium, and serum alkaline phosphatase, if I test this, okay, serum calcium, serum phosphorus, and serum alkaline phosphatase, okay, everything will be normal. All will be normal. In polyostotic fibrous dysplasia, I can say that the serum calcium is normal, serum phosphorus is normal. Okay, these both are normal, and but I can see that the serum alkaline phosphatase is slightly raised in the initial stages. Okay, in initial stages it is slightly raised, not much. It is near to normal. Okay, so this is about the fibro-osseous lesions, and the first one, fibrodysplasia. I hope you understood what is the concept of fibro-osseous lesion and what is fibrous dysplasia. This much is necessary, enough for your NEET NACT exam. If you read this, if you carefully listen this video, I assure you that you can write any question they ask from fibrodysplasia. Okay, so see you in the next video with the other fibro-osseous lesions. Bye.